Phoebe, can you share a little bit about the switch from our in-person services to our telephone services? For those of you who've been out to visit some of our housing sites, you know that a lot of search programs are in these congregate housing sites where we actually office at the homes, basically, of our clients. And so it's really accessible. It's easy for people to pop in. It's also easier for us to know what's going on. So this shift to now this telephone and virtual work has brought some unique challenges.
That's right. So, I mean, some of our teams before the pandemic saw some clients every day, you know, multiple times a day, saw them in their natural environment, in their homes. So we were concerned and just anticipating a great challenge as we switched to primarily operating remotely. So what we found, you know, both from collecting information from our staff as well as the survey that Alexis mentioned earlier, was that about 25 to 30% of our clients in housing had a hard time staying in touch with our staff remotely. Mostly it was due to not having a phone. Some of it was, you know, some of the government subsidized phones that our clients have had limited minutes initially. And then sometimes our clients just may not have wanted to call us back for a little while, but it's hard to gauge, right? On the flip side, what that meant is that about 70 to 75% of our clients were able to stay in touch with our staff pretty regularly during this time. And we just had to get creative with the other percentage. So, you know, we worked closely with our property management partners. Many of them were still working on site, even if in like a reduced capacity. So, you know, at one of our housing partnerships, Temenos Community Development Corporation, we have clients housed at 3 of their sites. And what they did pretty early on was they purchased a phone for each site that clients of ours could actually check out. So, I mean, they would check them out. They would vigorously wipe them down, right, with Clorox wipes afterward in between each use. But the phones were there actually so that the residents could get a hold of our staff. Because, you know, that connection was so important. So we found that that was really useful. And, you know, as we started going back out to visit clients with, you know, PPE, with proper social distancing, we really prioritized those clients who we haven't been able to keep in touch with. So we had lots of kind of team meetings where we talk through, okay, who have you been in contact with? Who have you been in contact with? Who have we not heard from? Who are we most worried about? Let's put them on the priority list. So we've been able to do some of that as well and get our eyes on some clients, you know, who we haven't been able to get in touch with via phone.
So, you know, even when we can get in touch with clients, then of course there's this question of how effective can you really be virtually, right? It's very different. And of course, you know, part of the reason that we put our staff out in these housing sites is proximity and accessibility and closeness. That's why we want to meet with our clients. That's why we, you know, navigate clients. That's why we kind of go on the journey to housing with our clients. And so, of course, not having that physical connection anymore, being in the physical space, brings up a lot of questions about how effective we can really be. So, Phoebe, you want to say a bit more about that?
Sure. That was definitely a huge adjustment. We pride ourselves on being accessible and having quality face-to-face interaction with our clients. And so, you know, I mean, some of that is a little bit of what I mentioned earlier, is it's harder to assess what's going on with folks, especially in more complicated situations like, you know, folks experiencing physical or mental health deterioration, right? That's harder to gauge just simply by talking to someone over the phone. Or, you know, if folks are having a hard time keeping their living space, their apartment, clean and organized and sanitary, typically we'd be able to pop by and see that with our own eyes and try to help address that. But we were limited in that way. So some things that, oh, and then to add to that as well, you know, in our housing programs, much of our work goes beyond just meeting basic needs, right? We really work with clients on all different areas of their lives. So a lot of our conversations have to do with pretty sensitive topics, right? Things like their health, struggles with substance use, difficult family relationships, managing money, right? Like who likes to talk about that over the phone? So, those are some of the things that we were wondering, will clients still engage with us over the phone, with these deeper conversations? And it was an adjustment. I would say the first few weeks, a lot of the conversations were really just about surviving the pandemic, right? Getting the right information, where are the food pantries that are open. But in my conversations with staff, that I supervise, I'm checking in with them weekly as well. I started hearing a shift in the conversations. So even just these past few weeks, a lot of what staff have been sharing is that their conversations have resumed. And it's still, the pandemic is still prevalent, but a lot of other things are still going on in clients' lives. And what's ironic and interesting too, and you all might have experienced this as well, is sometimes it's easier to talk about things without seeing someone face to face, if you're like side by side or if you're on the phone, because maybe it feels a little bit less intimidating. So there was some of that as well. And then, of course, as I shared, for folks who are harder to get a hold of or more vulnerable, we've been just trying to reconnect face-to-face safely as well.